Okay, so hopefully you can join us. If you haven't RSVP'd, we might be on a wait list, I'm not sure, but we will try and work the wait list if we have cancellations. So let's jump into our subject about enhancing your results. So let's say you've done some of the procedures, or you're just looking to take care of your skin, because this would actually pertain to you as well. Or maybe you're just starting out. I like to think about this analogy of a mattress, a lumpy bumpy mattress, and a wrinkled stained sheet. So some of the things that we've talked about more procedurally, for instance, fillers, or maybe a halo laser, or maybe the Vivace, some more involved procedures, that sometimes is more like firming up the mattress. You're cleaning up a lot of stuff and you're giving yourself a nice firm mattress. That wrinkled stained sheet is the skin proper. So if we were to somehow lightly fillet the skin off of your face and lay it out flat and look and go, well, what's going on here? Are there discolorations? Are there fine lines? What's the texture like? Pore size? All those little things. That's kind of the skin proper, and that's the sheet part. And I think to make those results kind of pop and look a little bit better, you really do want to take care of that skin proper too. Or in the case of fillers and Botox, you want to take care of the skin. In the case of when maybe you already have taken care of your skin, you've done some lasers, you've done the Vivace, you want to kind of enhance those results too. This becomes really important because you don't want to just spend time, money, and effort on something and then just not take care of those results. So I think this is a very important concept to understand. And the way I like to conceptualize the skincare proper is as a therapeutic ladder. And so what I mean by that is at the very bottom rung of the ladder is kind of the easiest things to do, where you have the least risk, less cost, might take you longer to get there. At the very top rung of the ladder, you have things that maybe have a lot of big wow factor, but super aggressive, downtime risk, et cetera. So like at the very top of the ladder, in my mind, would be something called like a CO2 ablative laser, which we don't even do. I mean, that's an old-timey thing, but that's, a lot of stuff. And most people don't need that. At the very bottom rung of the ladder is just your day in, day out skincare. And there's things in between. So I'm going to say, upper mid-range, we would start getting into things like the halo or the Vivace. So we've already covered that in some prior noon Zooms. So we're going to talk about the bottom part of that therapeutic ladder, because those are the things that you would do after a procedure like a Vivace or halo, or again, if you're starting out, or if you're, you've done your fillers and you're just looking to do something to freshen up your skin. So we'll start with the very bottom. So day in, day out skincare. Let's talk about that. If you do that, do the right things, and you do it consistently over time, are you going to get a result? Yeah. Is it going to be a huge result? No, but it will be noticeable. And I think that's the important thing, is like you have to be consistent. And there's a lot of different, skincare options out there. And I'm not saying that those are wrong. I just feel like I've been doing this for 25 years. This is what I do myself personally. And I feel like this, what we call our core 4, works, and it's easy. I like things that are simple. I don't like to overcomplicate things. So we're going to go over the core 4, and we're going to start with number 1. So our first core, and what is that? Sunscreen. So you could have figured that one out. Dermatologists love to talk about sunscreen, but it's so important, and it should be the base of any skincare regimen. In fact, if you're super lazy and you only want to do a core 1, do this. SPF 30 to 50 on a daily basis. It's important to do that every morning, rain or shine, and you want something that covers both UVA and UVB rays. So the UVA rays are the ones that tend to penetrate a little bit deeper, that break up your collagen and elastin. The UVB rays are the ones that are more superficial, that can cause burns. If you drive in your car a lot, you really need the sunscreen as well, because most windshields will block the B rays, but the A rays are getting in, and that can really cause a lot of photo aging and sun damage, which is why it's interesting doing fillers or even talking about lasers with people. And you might notice this in yourself, that the left side of people's face is frequently more wrinkly or mottled. You see more brown spots than the right, and that's just from people sitting in their cars. So sunscreen's hugely important. Okay, core 2, what is that? That is going to be your retinoids. So that's a big umbrella term. I think a lot of people are familiar with retin A, which is a retinoic acid. And if you're familiar with those, they have different strengths. There's 0.025, 0.05, up to 0.1, and people get really caught up in the numbers game with that. It's like, oh, I need more, like stronger is better, but that's not necessarily true. You really want to come into retinoids realizing that your skin needs to be comfortable with whatever product you're using. So sometimes it's hard to jump right into sometimes a retinoic acid. So we have things that are called retinaldehydes, we have retinols, and we have the retinoic acid. So if you remember from high school chemistry, you have the aldehydes, the alcohols, and the acids. Anyway, they do all turn on the retin A receptors in our skin, which actually helps to produce collagen, elastin, helps with texture, helps with fine lines. It's probably the most widely studied anti-aging topical medicine out there. It's been around since I think the 70s. So it does work, but you have to do it consistently. I hear a lot of my patients sometimes complaining that it's too hard to use it, and that's because a lot of times they'll come in at too high of a level. The retinaldehydes are the most patient friendly, and it's where I frequently start people. There's different strengths there too. And I usually will tell people as you're trying to build up in retinoids, when you're 2/3 or 3/4 of the way done with a tube, you need to let us know. And what we want to do is give you the next highest strength in that category so that you can kind of start to alternate back and forth. Then when the weaker one is done, you're on the next higher level. And then as you go through that, when you're 2/3 or 3/4 of the way done with that tube, let us know and we'll bump you up. Maybe you go from retinaldehyde to retinol, different levels within that. And then maybe eventually you end up in a retinoic acid. Maybe you don't. It's okay. We just want you in that box of that retinoid category and doing it consistently and something you're comfortable with. So that's easy. And again, if you're another person who's 4 is too much and 1's too little, core 2 would be sunscreens and retinoids for sure. Okay, moving on to 3. So what's the third one? Third one is antioxidants. People are most familiar with vitamin C, but there's actually quite a variety of antioxidants that we have. And I think it's important to find the one that's comfortable for you. A lot of times people will find, especially in the South, they get really oily in the summer. And so sometimes you want to use more of a serum antioxidant. And maybe in the winter, you're drier and you want to move over into something that has more of a lotion form. So they do come in different formulations. So I think it's important to find one that's right for your skin type, something you're comfortable with, and sometimes to rotate what you're doing so that it's appropriate for the season or the stage that your skin's in. Or if you have something like rosacea or acne, we want to be able to tailor that antioxidant for you so it kind of gives you maybe a little bit of help with whatever underlying medical condition you might have as well. Okay, and then lastly, 4. The fourth core is growth factors and peptides, and these are really workhorses for improving collagen and elastin. Growth factors and peptides are little proteins in the skin. They're signaling proteins that kind of direct your skin to kind of produce the collagen, elastin. And I think, again, that combined with your sunscreen, your retinoid, and your antioxidant, that's a comprehensive anti-aging program. The great news is if you're a little bit on the lazier side, you don't even have to have 4 products. There's a lot of combo products out there that combine maybe your antioxidants and your growth factors, or antioxidants and sunscreens. And so we have a lot of ways to kind of help you streamline things. I do not like wasting time, effort, or money. So you really want to make sure that you're on the right products, that these are easy to use, and you also want to know when you're finished with something, what do I do next? And we love to help you with that. So our Advanced Skincare Center is here to help educate you. So I went through this, I know, pretty quickly. If you're confused about it and you're not sure, you can stop by anytime, and our advanced skincare consultants are always happy to help you. And it's fun for us. We love to kind of teach these types of things. So that's the base, right? Your day in, day out skincare. If we can kind of get you doing something on a continuous basis like that, that will make a difference over time. We actually do something called a Visia too. I think we talked about that briefly, but if you haven't done one before, I highly encourage you to do it. Visias are just pictures of your skin, and it gives you information about compared to other women your age for things like texture, pore size, brown spots, red spots, porphyrins, bacteria in your skin. So all different kind of parameters, and you get kind of a ranking or a rating, if you will. And that's really, I think, nice because it gets you a little bit more targeted in what you're doing. If you're picking either products or procedures, knowing that you're targeting your problem areas, I think, is really valuable. It's also sometimes fun, like we've had some patients through the years and even employees who maybe never had a great skincare regimen, and it's really fun to see the difference in their skin 6 months or a year down the road just by doing the right things skincare wise. So it absolutely can be impactful, but you just have to do it consistently. Okay, so moving up this therapeutic ladder, again, if you want to kind of, maybe you've done, again, your halo laser, or you've done the Vivace and you just kind of want to do something to maintain that texturally, you can do things like our lighter chemical peels. So chemical peels have been around for a very, very long time. Actually, that was probably the first aesthetic ancillary treatment we ever offered at Dermatology Center of Atlanta back 22 years ago. And they're easy to do. They come in a lot of different strengths, and there's little to no downtime with these. I mean, really, we want them to be easy procedures. You do, because they're lighter, you're going to do them in a series, typically about 4. And then you could kind of do maintenance things. I think, maybe after you do your series, you could do it maybe every 3 months, or you could just do another series in a year. But it's a really nice thing to do, again, after, if you've done something like a bigger procedure, and you're like, gosh, my skin needs a little something to perk it up, but I don't want to go through this whole procedure again. What do I do? Maybe a lighter chemical peel will be for you. Maybe a hydrofacial. Hydrofacials are, if you're familiar with dermabrasion, it's a way to kind of exfoliate the skin, but the hydrofacial does it with water. And it's water, it's suction, and it's also infusing different serums into the skin. And what's nice is you can customize it. So if you have pigment issues, if you're concerned with aging, or if you have some acne, we can kind of customize these serums for you. It's really nice too if you're trying to clean out the skin and clean out the pores after the hydrofacial. Everything that comes off of your skin and out of your skin is in a little cylinder. Some people get really excited about what they see. I don't like to see it, but you do you. But you do know it's working. And I think it's also a great thing to do if you have an event coming up and you're like, I need my skin looking better fast. I don't have time for downtime though. Hydrofacials are wonderful because if you do them, within, I'd say 72 hours of an event, the infusion of that, of the water really kind of helps to plump up the skin and makes things look better. It makes things look fresher, and you really can enjoy that for a temporary effect. But if you do them in a series, again, you get more of a longer lasting effect where it really does help to enhance your whatever procedure you've done. So that's an easy thing, I think, that a lot of people like to do in between their bigger procedures. And then lastly, I would say regular microneedling is something people will do too. So we talked about Vivace, and Vivace has that RF microneedling, the radio frequency. Maybe you don't need the skin tightening, or maybe you've already done that and you really want to work more on texture. Microneedling appointments are really nice because you have, again, very little downtime. I think they're workhorses for texture issues, or if you have some mild acne scarring, a really nice procedure to do. Again, it enhances maybe what you've done. It works. I think I like it a lot in people who have done fillers and say especially around the mouth area, maybe we're working on some fine lines like those smoker's lines. And the fillers make it look better, but there's still textural issue that remains. Maybe this person doesn't really want the downtime associated with a more aggressive laser. Microneedling is wonderful. You do a series usually of 3 of those, and that really helps with the collagen building too. So that is something that I think really can enhance a filler result. So we've gone through a lot of different things, but I think these are important things to consider when you've again, done maybe a bigger procedure and you're looking for something that will enhance or complement what you've done. So remember your day in, day out skincare, maybe consider lighter procedures, and I think you'll be on your way to great looking skin year round.